we're going to be talking about knee replacements. So for diagnosis, the person will be told that they need a knee replacement when their pain becomes too much and it impacts their daily lives. For example, if someone can't do basic things such as going to the grocery store or getting to their car or doing minimal exercise without feeling pain, then you know it's time to get a knee replacement. Some non-surgical methods for treating knee replacement include physical therapy, light exercise, splinting or bracing, anti-inflammatory meds, or shockwave therapy. Now, these do not remove the pain completely, but they can help. The surgery itself, the patient is put under general anesthesia, not local. The surgery itself takes about 60 to 90 minutes, so it's not that long. And if you choose to have the procedure done, you could do it either laparoscopically or traditionally, and if you choose to do laparoscopically, it will be minimally invasive. Small surgical instruments will be inserted through small holes in your knee, and this will leave less scarring. And if you opt to do traditional knee surgery, then the surgery will be done through a cut from the middle of the knee through the muscles and the tendons and the ligaments in order to get to the joint, and this procedure will leave more scarring as opposed to laparoscopy. After your surgery, you'll spend about 3 days or less in the hospital if it's not done laparoscopically. Medications are delivered to you through an intravenous Medications are delivered intravenously, and you may receive blood thinners to prevent clotting in your calf and your thigh. You'll be monitored for swelling to make sure that no infection develops after your surgery. Following surgery, you should be able to stand and begin basic movements the day after, and swelling is normal for as long as 6 months after the procedure. Regular exercise to restore strength and mobility to your knee.
Hi, I'm Noah. We'll be talking about the second part to knee joint replacement. So after having your surgery, regular exercise to restore strength and mobility to your knee is very important. Now, a surgeon or the therapist might recommend that you do 20 to 30 minutes, 2 or 3 times a day, walk for 30 minutes, and then this could lead to an early recovery. Now, some exercises you may want to do are quadricep sets. This is when you tighten your thigh and straighten your knee out for about 10 seconds. You can also do straightened leg raises by tightening your thigh muscle with your knee fully straight up in the air until your leg is completely fatigued. After your surgery, you will be able to walk short distances. Then after that, you are able to climb stairs, and then sometime you may be able to fully return to your daily activities. Any major surgery can have complications. A complication of knee joint replacement is deep vein thrombosis. This is a blood clot. Certain complications include blood loss, infection, early hemorrhaging, wound breakdown, fractures, and you can have anesthetic problems, as well as cardiovascular, respiratory, renal, electrolyte, and other medical issues. If the deep vein thrombosis moves or embolicizes in the lung, it can cause a huge danger to you. The federal program that tracks treatment of its patients, normally about 65 and older who have knee replacement surgery, are found to have that 5% who receive their implants develop complications, meaning that around 94% of knee replacements last around 20 years. For 80 to 90% of people who have total knee replacement, their new joint lasts about 20 years, and it may well last longer. If you have partial knee replacement, you're more likely to need a repeat operation. About 1 person in 10 needs further surgery after 10 years. Some fun facts. The most common reason for knee replacement is the pain from osteoarthritis, rather than a specific trauma to the knee. In the late 1970s and often the early 1980s, people heard about knee replacement surgeries going wrong. Those suffering knee pain regularly walked until they were wheelchair bound before seeking treatment. Knee replacement was the last resort then. There are a bunch of physical therapy medications to reduce the pain and inflammation, and you can use a device like a cane. But obesity also increases the risk of osteoarthritis in the knee because it increases pressure on the knee joint. Further, obese people tend to do less physical activity, which creates a loss of muscle that surrounds and protects the knee joint. Thank you for having us and listening to us today. Goodbye.